It says, can you speak about ALS, Lou Gehrig's disease, amyotrophic lateral sclerosis? When I talk about ALS, I also will be talking about MS, multiple sclerosis, and also Huntington's disease, and also Parkinson's disease. All four are approached the same way with nutrition. Parkinson's disease, Huntington's disease, MS, and ALS Lou Gehrig's disease, all four. So nobody will need to ask about these because it'll be the same approach nutritionally. Now I'm going to talk about 100 pounds. The dose goes by poundage. So we'll talk about a dosage for 100 pounds. It'll be one healthy brain and heart pack per 100 pounds of body weight. Remember, that's for those four diseases. And get an extra bottle of the secret sauce we call selenium. And so they can take 6 a day, 3 at breakfast, 3 at dinner, or 2 at breakfast, lunch, and dinner. And then I also take a program we call Synaptive. If you know about brain functions, synapse, where the one nerve fiber speaks to another, synapse, synaptive, okay? Synaptive, okay? And I want you to take 3 of those twice a day per 100 pounds of body weight. It'll be 2 bottles a month, Synaptive. And then you need to eat 8 eggs a day per 100 pounds of body weight. They cannot be fried. They cannot be cooked in oil or margarine. They have to be either poached with a soft yolk or soft boiled with a soft yolk or soft scrambled in butter. And that's to give you the cholesterol necessary to rebuild the brain, the part of the brain that's damaged. They're all really the same disease. It's just a matter of where in the brain the more severe damage occurs. You get a different symptom based on the different parts of the brain. And they give it a different name. You could have all four. You could have MS, ALS, Parkinson's disease, and Huntington's disease all at the same time. But doctors will pick the name of the one that's most obvious and give it that name. Okay, so there you go. ALS, MS, Huntington's disease, and Parkinson's disease. Okay, gentlemen, yes, sir.
Right. Dr. Wallach, I thank you.
Okay, this microphone isn't working very well. I need to turn it on or get closer. Or...
I thank you.
There you go.
Thank you again. I thank you for being here.
Thank you.
You're just talking about the brain. I've been hit in the head a couple of times. Pretty good.
Now, is this with a baseball?
No.
Falling off the roof? Or?
No, a brick.
A
piece
brick,
of
okay.
steel coming down about 35 feet.
Okay.
Knocked me on my knees. I have problems with my knees and my hip.
Okay. Okay.
Maybe you could prescribe something for me.
Sure, very, very easy. The brain wants to recover. The brain can heal itself, contrary to what doctors say. Your brain can heal itself very nicely. And your nerves and your neck and your vertebrae and your hips and knees. And so what I would do is take 2 of the healthy brain and heart packs per month. 2, this is for head trauma. 2 healthy brain and heart packs per month, a full dose of everything at breakfast and a full dose of everything at dinner time, because you weigh somewhere around 200 pounds, give or take a few pounds. And I would also take the Synaptive again, take 3 of those twice a day. I'd also take the 8 to 10 eggs a day. But I also throw in the glucogel. The glucogel is the secret sauce to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, back, hips, knees. I'd have you take 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner. And this goes for anybody that has osteoporosis, osteopenia, arthritis, bone-to-bone arthritis, rheumatoid arthritis, bone spurs, calcium deposits, periodontal disease. And whatever pack you take, you want to also take those 2 bottles of glucogel, so you can take 15 a day, so they'll support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Okay?
Thank you.
You're very welcome, sir. God bless you.
God bless
okay,
you.
I'm going to jump over here. Yes?
I just want to welcome you for being here today.
Get a little closer. There you go. Thank you, Pastor.
Good afternoon. I just
Thank
wanted
you.
to welcome you for being here today. It's
Well, thank
our
you. Very
pleasure.
gracious. Thank you.
Also, I wanted to ask you about, I have a history of pulmonary embolism, and it imitates the factor V. You know, if your mother have it, you have it, but it isn't. So I wanted you to give me some
Sure.
advice on that.
Okay, pulmonary embolism is a blood clot, okay, caused by deficiency of omega-3 essential fatty acids, whether it's a blood clot in the brain, heart, or the lung. Pulmonary embolism means there's one of these blood clots in the lung caused by a deficiency of omega-3s or a ratio problem between omega-3s, 6s, and 9s. And obviously, when you take in inflammatory things like fried foods, it makes it worse. It makes the lining of the arteries all inflamed, so it makes the deficiencies worse. And so what I would do is go ahead and take 2 of the Healthy Brain and Heart packs per month, full dose, something twice a day. I would also take what we call the Ultimate Daily Classic. Ultimate Daily Classic, or tablets. I'd go ahead with 1 bottle a month, and that's going to allow you to take 3 of those tablets twice a day. And what it's going to do is support healthy dilation of the blood vessels in your lungs. It's also going to support healthy blood clotting systems, so you're not going to have a blood clot when you don't need one. And it's the Ultimate Daily Classic. Take 3 of those twice a day. That's in addition to the 2 Healthy Brain and Heart packs. None of the bad stuff, no fried foods, no processed meats, no oils, no gluten. So the next time I say none of the bad stuff, everybody knows what that is. And it's not genetic. The reason why your mom has it and you have it is because she has a gluten intolerance. She's passed that on to you through cord blood. Do you have children?
Yes.
Did any of them have any asthma?
Yes.
Bingo! Okay?
Yeah.
That's because those things are all caused by gluten intolerance.
Wow.
And so it's a trail from your mom's mother. All her sisters and brothers have it. Your aunties on your mama's side have passed it on to their children. If you have daughters, they better be gluten-free, because if they're not gluten-free, they will pass it on to their children. If they're gluten-free, they won't.
Wow. That's
Okay.
awesome. As a matter of fact, I never was asymptomatic of asthma until now.
Mm-hmm.
But my kids always like, Mom, you cleaning and that Clorox and, the smells.
No, it's a deficiency. Okay, so now
Thank
you know
you
what to
very
do.
much.
God bless you.
God bless you. Thank you so much.
Thank you. Okay.
Dr. Wallach, side note, for people that, how do we handle, so someone's out there listening, they hear you address someone that has what they're struggling with, how do they handle that in terms of going to the table?
Well, if they already know, if they're standing outside, if they're here, they go right to the table.
So if they're sitting out there and you address something that they have.
They can go right to the
and
table.
just tell them what they have?
Mhm.
Just, if they're streaming,
Oh,
what
if
do we
they're
do if they're streaming?
Basically, what I would do is collect some of this information on a piece of paper like you gave me before. We can answer one of those every time we do 2 of these, kind of thing. But you're blessed in having Michael and Kim, because they're very knowledgeable. And so you can email these things to them later.
Okay.
I mean, you can do this for the next 6 years. You can email these things to them, and they will know what to do.
Okay,
If
just
they run
not
into something
tomorrow
they
on
don't, they
Super
can
Bowl Sunday.
contact me.
Okay. The what's the website? Can we give the
No,
website?
well, they have to.
We'll do it before we
Yeah,
close.
get the website from them,
Okay.
because we have thousands of websites based on individuals, and so
Gotcha.
I try not to have any in my head.
Okay, so everybody clear, if Dr. Wallach answers a question of what you're dealing with for somebody else, then you can just try to remember what he said, but more so go out to the table and tell them, I have this, and they'll tell you.
Oh,
Has
yeah,
everybody
no
got it? Okay.
Hey, your turn.
Hi, Dr. Wallach. What would your diagnosis be for? I'm a 32-year-old woman who's had 2 heart attacks already.
Okay, 2 heart attacks. This was a blood clot in the heart, cardiomyopathy, bleeding heart attack. What kind of heart
Blood
attack?
clot in the heart.
Say again?
Blood clot. I have
Blood
4
clot, okay.
stents, but my cardiologist doesn't talk about nutrition at all.
I'm sorry, I didn't hear that last
I
piece.
said my cardiologist doesn't recommend anything nutritionally for me at all.
Well, it's because he knows nothing about nutrition. Okay, so you're kind of a big girl. What do you weigh?
200.
200,
10
okay.
pounds.
I would take 2 Healthy Brain and Heart packs per month. It's starting to sound familiar. Anytime a heart's involved, blood vessels involved, heart attack, stroke. So you want 2 Healthy Brain and Heart packs per month, a full dose of everything at breakfast, full dose of everything at dinner time. I would also get the ultimate, don't play with your paper. Yeah, put the paper on the floor. Thank you. Okay. You also want the Ultimate Daily Classic. Go ahead and take 3 of those at breakfast, 3 dinner time, a bottle a month, Ultimate Daily Classic. And then I would also throw in what we call the Ultimate Cardio Sticks. The Ultimate Cardio Sticks. So you tear the top off, you put them in a bottle of water and drink it. I would go ahead and take 2 of those a day. There's 1 per 100 pounds of body weight, so 1 at breakfast, 1 at dinner time. And they're going to support blood flow through blocked arteries. They're going to support lowering blood pressure. I don't know if you have a blood pressure problem associated with this sometimes. But this is all nutritional deficiencies. It's easily dealt with. And you do have to stay away from the bad stuff, the fried foods, the processed meats, the oils, and gluten, right? Okay? And again, the reason why your doctors don't talk to you about nutrition is because they don't know much about it. It's probably good that they don't talk about it.
I have one more question.
No, you only get one.
Oh,
Apologize. You only get one.
seriously? Okay.
There's one. Yes.
Hi, yeah, hello. I just
Hi.
wanted to clarify, with autism, you said that is it something that's, there anything to do now, or I have a 6-year-old who has autism.
I missed that last part?
I have a 6-year-old who has autism.
Okay, autism. Autism is not genetic. Autism is a nutritional deficiency of the brain. We're talking about autism, ADD, ADHD, depression, manic depression, bipolar disease. Bipolar disease when you're in civilian clothes, when you have PTSD, okay, post-traumatic stuff. This is when you're in a military uniform. It's really just bipolar. And then there's schizophrenia, and then there's psychoses, anxiety attack, panic attack, all caused by the same thing. It's 1 or more deficiencies of the brain. The brain requires all 90 essential nutrients. Now, kids can be born perfectly normal, and then if they're deficient in their formula or the mother's deficient in the breast milk, then the baby will gradually, over time, it could be days or weeks, get autism. Or the baby can be born with autism. There's nothing mechanically or physically wrong with the brain, so that it's something that's fixable. Sometimes babies have autism, but they also have the equivalent of, even if the mother didn't drink or take drugs, they might have the equivalent of what would be called fetal alcohol syndrome, where they do have some permanent retardation because there's a little piece missing in the brain because mom was missing something. And then you can get rid of the autism piece, and the kid will be significantly better, but not perfect. So, I mean, there's all these possibilities. Without talking to the kid and knowing more history, it'd be hard to tell which one.
She can't talk, so
But
she wouldn't be able
she
to
was born
answer.
normal and sort of developed this at age 4.
She developed it, she was diagnosed at age 2. Age 2, she was
At
diagnosed.
age 2, yeah. Well, she was okay until she was 2, and then she developed at age 2. It's reversible. Okay? So what I would do is a child like that, what does she weigh?
50,
50 pounds?
yeah.
Yeah. So what I would do is get her 1 healthy brain and heart pack. That's going to last her 2 months. That's meant for 100 pounds for a month. So she weighs 50 pounds. That's a 2-month supply. And you mix up a full dose of everything, like it says, and then give her a 1/4 of a dose at breakfast, 1/4 of a dose at dinner. So that's her half for the day, right? And that should last her, that whole package should last her 2 months then. But get her away from the bad stuff. Again, last time, no fried foods, no processed meats, no oils, no gluten. And in her case, no sugar. That means no fruit juice, no fruit. She can get everything she needs from fruit, from vegetables. No stir frying. And you got to keep them away from the bad stuff because that's where the problem lies. Okay?
Okay.
Very good. Question?
Hi, Dr. Wallach. Thank you for coming.
Thank you.
My question is, what can I do or use for gait imbalance? I have, my body wants to go straight, but it leans, and sometimes I have difficulty walking.
Okay, now, is this, she has a balance problem. Now, is this a,
Cerebella something?
okay, were you born this way?
No,
Okay,
not to my
then it's
knowledge.
not cerebellum.
Well, that's what the doctor said.
Okay, yeah, it's not cerebellum. It's not cerebral palsy. If you were born normal,
Right.
how long ago did this develop?
It's been going on for about 1.5 years.
Okay, so 1.5 years. Yeah, so it's not a genetic defect. It's not a congenital defect. You weren't born that way. And this can be due to osteoporosis of the skull,
Okay.
or you could have one hip, one leg shorter than the other. I mean, there's all kinds of possibilities here. But if it has to do with the brain, doctors forget that you get osteoporosis of the skull, just like you do your legs and your pelvis and your vertebrae. When you have osteoporosis of your skull, the bones get thicker. Oftentimes they called Paget's disease. And when it gets thicker, the canals that the nerves come through, there's 12 pairs of cranial nerves. 12 come out this side from the brain, 12 come out from this side of the brain. And the one that affects your balance, and you feel like you're maybe in motion, do you ever get like motion sickness, a little nausea with it?
Yes,
Yeah. Do you ever
sometimes.
get ringing in your ears?
No.
Or no tone or chirping or anything?
No.
Okay. But if you feel a little nauseous sometime, you feel like, man, the room is swimming, like motion sickness, this could be caused by osteoporosis of the skull. And the canal that the 8th cranial nerve is going through is filling up with scar tissue because you have osteoporosis of the skull. And when you squeeze the vestibular branch of the 8th cranial nerve. In the old days, you used to call it Meniere's disease, and today they call it Wallach's vertigo because they figured out what causes it.
Right.
So what you need to do, you're a tall girl, so you're going to need 2 healthy bone and joint packs per month.
Okay.
2 full doses a day, a full dose of breakfast and dinner, 2 healthy bone and joint packs per month. And you also want to, in each one of those healthy bone and joint packs is going to be a wide mouth jar of CM cream, which is a topical pain reliever, anti-inflammatory. You're going to take a 1/4 teaspoon with a Q-tip in the morning when you wake up, put it down in your ears, like you're trying to get
Okay.
wax out, and then in the middle of the day, like 3 o'clock, kind of halfway between lunch and dinner, do it again.
Okay.
And if that's correct, what will happen is you're going to see relief for 3 to 5 hours.
Okay.
Be different. And if it's in your hips, then it won't affect it at all because it's in your hips.
Okay.
Okay?
Thank
And
you so much.
You're very welcome.
Have an amazing day.
Oh, yeah. Well, I'm just being here with you is an amazing day. Thank you, dear. Okay, back to you.
Okay. My son, he's 4. He has severe allergies. He's allergic to the top 8 and corn and sesame seed. He has extreme itching, eczema. I haven't seen his skin clear since he was born.
Okay, so he has eczema. Does he have any respiratory stuff or bowel things?
He had he was getting colonoscopies, endoscopies
How
when
old
he
is
was
this
first
child?
born. He'll be 5 next month.
5 next month. They're doing a colonoscopy on him.
Tonsils, adenoids,
Yeah,
removed.
we need a new doctor here. Okay, doing a colonoscopy on a 5-year-old kid. Somebody needs to go to jail here. I could say some things, but I won't. Okay. I'm getting breathless here because of this. Okay. Basically, when a child has eczema and bowel problems, it's because they have what? A gluten intolerance. Now,
Right.
did you have asthma as a child?
No, his father did.
Well, it's not going to come from the father.
Yeah, I did.
Okay. Even if the father had asthma, it's not going to come from the father. Do you have any other children?
No.
Do you have any brothers and sisters?
Yes.
Do any of them have asthma?
Yes.
Bingo! There we go again. Okay? So, yourself, your husband, the boy's father, your brothers and sisters, your mama, if she's still alive, all your mama's brothers and sisters, your aunties and uncles, all of them got to be gluten-free. Okay, and what does this child weigh?
He's almost 40, and he is gluten-free now, though.
I don't
'Cause
believe it. Are
he's
you gluten-free?
allergic. No.
Well, then he's not gluten-free.
Okay.
Are the dogs and cats in the house gluten-free?
He's allergic, so we don't have any.
Okay, what about anybody else living in the house? Grandma?
No. Just
Does he
us.
go to babysitters?
He's at the daycare.
Daycare? Are they all gluten-free?
Do you mean in the environment?
Yeah.
Oh, okay, yeah, no.
No. And so he's not gluten-free then.
Okay.
Okay, cross-contamination in the food preparation surfaces, the couch where people watch TV, hugging people that just had toast for breakfast, all the crumbs all over their clothes. Even the daycare person,
Right.
they had a breakfast sandwich at McDonald's and they're full of gluten on their hands, and they take the child's hand and the child puts his hands in his face, and so dog food, for those of you who do have dogs, the dust from the dry dog food or dry cat food gets on you. The laundry where people wash their clothes, you wash your clothes in the same laundry as your child.
No, I separate that.
Say again?
I do it separately.
I don't care if it's separate, it's the same
Okay,
washer and
okay.
dryer. Yeah, I was getting
Right.
cross-contamination.
Okay.
I mean, you need to clean this environment up. I mean, really be obsessive about it, okay?
Okay.
And then the child weighs 40 pounds, you say?
Yes.
Okay, well, approach it as 50 pounds. So it'll be 1 healthy brain and heart pack. Can last him 2 months. So a half a dose a day for 2 months, right? And then you need to get another one. As he gains weight, the dose needs to go up. And this should go away fairly quickly, okay? But I would get another opinion before you start doing colonoscopic exams on a 4-year-old.
I stopped taking him to the doctor.
Oh, good.
Yeah.
Bless you, yes. Yeah.
Okay.
Because, how many of you have heard of the trouble with priests who are predators on the choir boys and stuff like that? Well, there's lots of sexual predators who become pediatricians. So think about that. Yes.
Yes. God bless you, Dr. Wallach.
Thank you.
Concerning pain, wherever the pain may be, because I'm a praying man, I haven't taken pain medicine in like 3 weeks, and I feel the same way I felt when I was taking the pain medicine. So what would you prescribe?
Okay,
for
now pain, you're talking about muscles, soft tissue, you're
Just
talking about joints?
in the body, in here.
Every place.
Yes, sir.
Okay, have you ever had a diagnosis from anybody? Like
Yes.
fibromyalgia or arthritis? I mean, what did they tell you? I mean, you know you have pain. You didn't need to go to a doctor to say you have pain. So what did they tell you?
They're saying that I had the condition, and because
What
it's-
condition?
They said I had arthritis. I don't believe
Okay,
it.
so let's say you have arthritis. You're a big fellow. You need 2 healthy bone and joint packs per month,
Okay.
right? Full dose of everything twice a day, except for the glucogel. You're going to take 15 a day, and all that would be accomplished by the 2 healthy bone and joint packs. You can use the CM cream topically on your knees, your hips, your elbows, or shoulders, or neck, wherever you have the pain. Soft tissue, muscles is fine. And what kind of work do you do?
In hospitality, catering.
I'm sorry, say again?
Hospitality, catering.
Hospitality.
Food, food and beverage.
Okay, you're not the cook, are you?
No.
Okay. And you're rolling out flour and bread and stuff. Okay. Yeah, you want to stay away from that kind of stuff. And none of the bad foods, no fried foods, no processed meats, no oils, no gluten. And also, you want to stay away from carbonated drinks, even ones you think of as being benign. Things like ginger ale, club soda, sparkling water, because the carbonation actually neutralizes stomach acid. It's going to prevent you from absorbing minerals. And so you got to stay away from all the carbonated drinks too. Okay?
Thank you.
Your bet. Yep. Question?
Hi. I got sick about 3 or 4 years ago.
You want to step up to the microphone a little bit? Thank you.
Okay, I got sick about 3 or 4 years ago, and I had pain, and before I knew it, I was in the hospital. The kids took me to the hospital, and they examined me just like that, and the doctor said, "Oh, your gallbladder is shot, we're taking it."
So you took your gallbladder
They
out.
took my gallbladder. So I want to know, because they're saying I don't need it, I don't believe that. So is there
Well, God put it in
something-
there. You need it.
Yes, my point. Yeah. So, I mean, is there a vitamin I can take? Is there something I can do to offset all
Sure.
that?
Now, the question is, do you still have any discomfort in your belly?
No, and it
Okay.
wasn't discomfort. I didn't even know I was sick. I thought I was having a heart attack. It was my first event. It just happened.
Oh, he said you had a heart attack.
No, I said I thought I was having a heart
Oh, okay.
attack, but they said it was my gallbladder. But I
Okay.
had never gotten sick before for that.
Okay. Then, do you have any skin problems, any eczema, dermatitis, psoriasis?
I've been in remission with the eczema for about 20-some years.
20-something years, okay. Guess what? You have gluten intolerance.
Okay.
So you need to get off of all gluten. No wheat, barley, rye, and oats. No fried foods, no processed meats or oils, right? All that's got to go.
Okay.
Now, the gallbladder, 99% of the time, is innocent. The gallbladder is just a bag. And if you had any stones in there, gallstones, they're made in the liver, and the liver drops them into the gallbladder. And so taking out the gallbladder is kind of insane, because that's like amputating a weightlifter's arms because he's got a big arm, because he's been weightlifting, right? And so what I would do is go ahead and take 2 of the healthy brain and heart packs per month, which is very good for the liver, full dose of everything twice a day. And then specifically, we have what we call the gallbladder in a bottle. It's a digestive program, and I want you to take 1 or 2. You'll decide which one's better for you. 1 or 2 of those ultimate enzymes. They're called ultimate enzymes. Like 1 to 2 minutes before each meal with a couple ounces of water. It'll be maybe 1 bottle a month. And we call it a gallbladder in a bottle because it has bile in it to help you absorb all the good fats, including fat-soluble vitamins, A, D, E, and K, good cholesterol, all the stuff you need to absorb. You have to have bile from the liver to do that. And your gallbladder just stores the liquid bile. And when you have a meal, it'll kind of squish, and all that bile goes in your intestines and helps you absorb those good fats. So you do need that, and so that's why we have the gallbladder in a bottle called Ultimate Enzymes. Take 1 or 2 of those, 2 to 5 minutes for each meal, a couple ounces of water, okay?
Okay. Thank you very much.
You're very welcome. Okay, question?
Yes. Dr. Wallace, thank you for being here.
You're very
I am
welcome.
diagnosed with macular degeneration. And I do have a spot in that right eye. And that's why I want to know.
Okay, she has
what
macular degeneration. Did you drive here yourself today?
No, my niece brought me.
Okay, can you drive?
Yes, I can.
Okay. Macular degeneration is free radical damage to the lining, the retina of the eye. And it's easily prevented and it's easily reversed. It's not genetic in any way, shape, or form. It's caused by free radical damage to the eye. So you got to change everything you're doing. No fried foods, no processed meats, no oils, no gluten. All that's got to go. I want you to remember that the eye is part of the brain, okay, and the brain is part of the eye. It's the brain has the optic nerve, goes through the skull, and then the eye is a ball, ball on the end of that optic nerve. So it's all part of the brain. So You need to get rid of all the bad stuff, and particularly things that produce free radicals. No fried foods, no processed meats with nitrates, nitrites, no oils, no gluten. And you want to take 2 of the Healthy Brain and Heart packs per month, a full dose of everything at breakfast and dinner. And then I would also get your auric points, your antioxidant points up to get rid of that damage. It's kind of like having really severe age and liver spots in the lining of your eye. And so what I want you to do, there's 3 things you can take to get your auric points up. And you kind of mix them up, one this week, another different one next week, and so on. So you can have a little variety, or you can do all the same thing. It doesn't matter. You need to get your auric points, your antioxidant points, above 100,000 per day. Auric is an acronym which stands for oxygen radical capacity, which is a measurement of how many free radicals are neutralized by the antioxidants in the product. At any rate, you can do that with either what's called Cell Shield RTQ. Take 5 of those twice a day. Or you can take triple treat chocolate, which is kind of fun. You take 6 of those a day, 2 at breakfast, lunch, and dinner if you like chocolate. And, or you can take what we call the Beyond Tangerine BTT 2.0 tablets. I'd go ahead and take 3 of those twice a day. It'll be 2 bottles a month. And that's going to get your auric points above 100,000 a day. Now, the BTT 2.0 tablets is a fairly economical way to get really over 300,000 auric points a day. For me, that's where I would do the BTT 2.0 tablets because I'd want 300,000 auric points, although 100 will do the job. But my vision is important to me, so I'm going to go with the BTT. But any one of them will work. You can mix and match them, get over 100,000, and these guys out there will help you do that. And I made a bet with a doctor once who called me a liar who was in the group. And I said, I can reverse macular degeneration even if you're legally blind for 6, 8, 10 years. He jumped up and said, Wallach, you're a liar. I said, well, sir, who are you? He says, well, I'm a medical doctor, eye doctor, and absolutely it can't be done. It's an age thing, and you can't stop it or prevent it or cure it. I said, well, sir, that's not correct. You want to do a little wager. And he said, yeah, I'll do a wager with you. He says, well, bring me 12 of your patients that are legally blind, 6, 8, 10 years of macular degeneration. And if I could get half of them in 90 days, 6 out of the 12, to read 20/20, would you apologize? He said, if you could get 1 out of 12, I'll apologize. So the next day, he brought me a box of 27 charts. True story. Brought me 27 charts. I had 300 witnesses in the room. And he says, here, pick your 12. And I said, well, who's going to pay for all the supplements? He says, well, let's make that part of the wager. If you win, I'll pay for it. If I win, you pay for it. I said, well, that's fair. I said, if that's the case, let's go for all 27. He says, you're on. So I filled out a form, as you're going to have filled out there. And I personally gave it to each of the 27 patients. I talked to each one because I didn't quite trust him. I didn't know if he was going to kind of purposely deep six it so he could win the bet. I don't know, because I didn't know him. And so I talked to each of the patients and gave them a handwritten thing of how to take the supplements. 90 days later, all 27, praise God, could read 20/20. Only 2 required glasses to make it happen. The other 25 didn't even need glasses. Now, he apologized in public, but he even did better than that. I just love that man. He made me a CD and told the story of the wager and tells how the thing went. And we sell millions of those CDs every year. It's called Seeing is Believing. Seeing is Believing. And so you need to get that CD. Tell me you want the CD, Seeing is Believing. And then, of course, you want the 2 healthy brain and heart packs per month. Okay, a full dose for everything at breakfast, full dose for everything at dinner time. I would also get the Vision FX, so you can take 3 of those twice a day, be 2 bottles a month. And let's see, I would also take the Synaptive. Take SYNAPTIV. Take 3 of those twice a day, 2 bottles a month, okay? And then call us every 2 weeks and let us know how it's going.
Okay, thank
Okay,
you.
God bless.
Dr. Wallach, we have an online question. An online viewer has carcinoid cancer, has already had his appendix removed because of it. Is there a natural cure?
Okay. Carcinoids tend to be only local. They rarely go other places. They're kind of a local malignancy where they just kind of grow locally. They rarely, if ever, go anyplace else. They are dangerous because if they erode a blood vessel, you can bleed to death. Because they release chemicals, you can get a stroke and so forth. So they're not harmless. But if you get cancer, that's one that's very survivable, carcinoid. And so what I would do is have them change everything they're doing. Get them on a gluten-free diet, no fried foods, no processed meats, no oils. And then have them take one healthy brain and heart pack per 100 pounds of body weight. If they only weigh 120, 130 pounds, get an extra bottle of selenium so they could take a minimum of 6 of those selenium a day, 3 at breakfast or dinner, or 2, 2, and 2. I would also have them take the BTT 2.0 tablets, 3 of those twice a day, so they can get their ORIC points above 100,000 a day. And that will do wondrous things for their immune system, which is their best friend. We cannot use the cure word here. There are certain limits by law that we can use the cure word. I can cure you of scurvy by giving you vitamin C. I can cure you of rickets by giving you vitamin D3. I can cure you of beriberi by giving you vitamin B1. I can cure you of pellagra by giving you vitamin B3. I can cure you of pernicious anemia by giving you B12. And then it stops, because that's all the doctors know. They don't know about the other 53 essential nutrients. And so by law, I can't use the cure word. And you've heard me several times talk about supporting and promoting maintenance repair. That's about as far as I can go. If you have, for instance, a bullet in you and surgically remove the bullet, I can cure you of that foreign body being you by taking the bullet out. But there are certain limits on what we can use the cure word for because of how the medical system has gotten things into the legal system. Okay? Okay. Did I answer the question?
You did.
Okay, very good. Yes.
Hi, Dr. Wallach. God bless you for your work you're doing.
Well, thank you. Very kind. I love God.
Amen. I believe it. About 2 weeks ago, I was taken to the emergency because I had a racy heart. And they did all of the preliminary tests. They said my heart was fine. They still want to do like a heart monitor and ultrasound
one that
on
they
my
put
heart.
on you?
Mm-hmm.
Yeah, now that's benign. That's fine.
Okay. And they had me on, I was already on the water pill, and then they put me on verapamil, I think it's
Rapamil, okay.
the lower dose.
Slow the heart down. Okay, now, let me ask you a couple of questions. Is that the first time you've had an episode like that?
I had one back in 2009 because I hemorrhaged, so my heart.
Sure, speeding up. When you get anemic for any reason, whether it's hemorrhage or nutritional deficiency, your heart goes faster.
And then in my 40s, I think I used to wake up and have the rapid, but it was stopped.
How old are you now?
I'm 55.
55. How tall are you?
About 5'3" and 3/4.
5'3" and 3/4. Now, have you shrunk any? Have you shrunk a ½ inch or maybe an inch since you were 20 years old?
No.
Would you better dinner on that?
No.
Okay. Yeah, you need to measure.
They just measured me, but she wasn't sure because the way I had my hair that day, so she wasn't sure whether I shrunk or not.
Yeah. So, I'm going to say something here in a minute, but I want to ask you a couple more questions. Do you have any history of any skin problems or asthma?
No.
Any of your children or brothers and sisters?
No.
Okay. Any
I'm sorry, my sister.
Oh, your sister has what?
She has asthma.
Has asthma? Okay. Then you've got gluten intolerance. She's got a gluten intolerance, right? And bowel problems, constipation, diarrhea, irritable bowel syndrome, colitis, diverticulitis, appendicitis, all that stuff. Anybody in your family have appendicitis?
No.
Okay, but you do have a gluten intolerance because your sister got asthma.
I was working on that, but to hear you talk, I'm not gluten-free. I thought I was, but then you were talking about the environment also.
You got gluten intolerance.
I believe it.
You can't deny it, dear. Okay.
No.
Now, the reason I ask you if you shrunk any is because there's a thing called atrial fibrillation. Did the doctor talk about AFib or atrial fibrillation?
He said something about sinusitis.
Okay. Yeah, sinus arrhythmias and that sort of thing.
Something like
yeah.
that.
That's the thing that controls the rate of your heart in the heart. But the main thing, somebody want to close that door back there, please? Thank you. But the main thing that controls the rate and rhythm of your heart are the spinal nerves coming out from between T1, 2, 3, and 4, the thoracic vertebrae, the first 4 vertebrae in your back, after your neck, and then there's T1, 2, 3, and 4. When the discs shrink there, those vertebrae get closer together, and they smash the roots of the spinal nerves that control the rate and rhythm of the heart. Now, did these things happen when you were laying down, or sitting down, or getting up, or reaching up, or when did it happen?
You mean the heart
Yeah,
rate?
the rapid heart rate.
I was actually asleep, and they kept asking me, did it happen?
Okay, so you were laying down. Okay.
Because when I would sit up, I noticed it would be a calm.
Okay,
when I was-
it calmer when you sat down, when you sat up.
When I sat up.
Okay. Well, this is a positional thing. This means that your vertebrae are squeezing the roots of those nerves. Either you got a bone spur on them, a calcium deposit, which is osteoporosis, or you've shrunk and those discs are thinner than normal and the vertebrae are squeezing the roots of the nerves. Now, this is actually called atrial fibrillation. Doctors will install defibrillators, pacemakers. They may have talked to you about that's a possibility in the future. They will kill parts of your heart muscle with electric shock to see if they can find the part that's running wild, as they call it. They can also then do a retroversion, which they electrocute you to death, hoping to reboot your heart rhythm. And then they can do a heart transplant, none of which is going to work because it's a back problem, not a heart problem. Your insurance company will pay out $500,000 to the doctor for a problem you do not have.
They did say I had stenosis.
Say again?
Stenosis.
I can't understand what you're saying.
Oh, they did say I had something called stenosis, where the spine is narrowing. Stenosis.
Oh, stenosis, spinal stenosis. Yeah, it could be
Yes.
spinal stenosis.
Yes, they said that I did have that.
Oh, there you go. There you had a back problem. Okay. And was it up in your back, high in your back, or low?
I'm not sure. I'm thinking lower, and then I have herniated discs also. from
Well,
years
there you
ago.
go. Okay, there's the disc problems. Okay, so yeah, this racing thing when you're laying down is due to degenerative disc disease. You sit up, it goes away. And so what I want you to do, what do you weigh?
About 150.
150. I want you to take 2 healthy bone and joint PAKS per month. Take a full dose of everything twice a day except for the glucose gel. I want you to take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint PAKS. You can go ahead and put the CM cream on your neck, just like a teaspoon, put it on your neck right down the middle and the first 4 or 5 or 6 vertebrae in your upper back between your shoulder blades and on an inch on either side. You use the CM cream. And it'd be very interesting. Take your pulse. You have one of these watches or devices that'll take your pulse. You can take your pulse twice a day. Just record it in a logbook. But sit there and for 10 minutes and calm down before you take your pulse, so you're kind of in the same situation all the time.
Okay.
And then give us a call. But the odds are it's AFib, which is caused by a back problem, not a heart problem.
Okay. Thank you.
You bet. Okay, your turn.
Good afternoon, Dr.
Good afternoon.
Wallach. It's awesome you being here.
Well, thank you. Very kind.
I have a family member that's been dealing with COPD.
COPD, okay, chronic obstructive pulmonary disease, okay.
Okay, and on top of it, they've been dealing with arthritis, like in their back and in their knees.
Sure.
What can be done with that right
Okay, is this a big person? Do they weigh 200 pounds or 100 pounds? Or?
200 pounds. They're a little shorter than me.
Okay, so 200 pounds. How old are they?
72.
72, okay. Well, COPD can be caused by smoking. It can be caused by eating lots of fried foods and getting scar tissue in the lungs. It could be a short order cook inhaling, the vapors from frying foods. It could be caused by working with chemicals and dust. It can be caused just by eating fried foods yourself and causing the arteries in your lungs to get scarred up and plugged up. And so what I want them to do if they weigh 200 pounds is to take 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Then I want them to take the Ultimate Daily Classic, 3 of those twice a day, okay? 2 bottles a month, the Ultimate Daily Classic, and this is to dilate the arteries in the lungs, get more blood flowing through there. I also want to take 2 a day, 1 at breakfast, 1 at dinner time, of the Ultimate Cardio Sticks. Tear open the top, pour in a bottle of water, let them drink it at breakfast and dinner time. And, of course, none of the bad stuff. Got to get rid of all the inflammatory things that have done this. No fried foods, no processed meats, no oils, no gluten. I would also throw in one more thing, which is an oxygen supplement. It's called Oxybody. They can take an ounce an hour before each meal. If it's a financial problem, they don't have to do it, but it'll speed things up. They can take an ounce like an hour before breakfast, an hour before lunch, hour before dinner, or not at all. But it'll help things go faster because it's an oxygen supplement is what it is, Oxybody, okay? Comes in quart jars. Okay, God bless. Okay, back to the center here.
Thank you for coming.
Well, you're welcome.
My question is very simple. I was diagnosed with a thyroid disorder about 20 years ago.
Okay, low thyroid or hyperthyroid?
I lost weight.
I'm sorry?
I lost a lot of weight.
Oh, you lost a lot of weight. Okay,
yes.
it could be hyperthyroidism.
Yes. So they put me on Synthroid, and I was told I would have to take this pill for the rest of my life, and that's what I
Did
wanted.
they take your thyroid out or kill it with?
They shrunk it with the iodine.
They shrunk it with radioactive iodine.
Mm-hmm.
Okay, but you still have it in there.
I think
Or is it
I
gone?
do. You tell me, you're the doctor.
Okay.
But they shrunk it with the iodine. That's what they did, opposed to surgery.
Okay.
So I'm taking this
Okay.
pill, and I want to know, do I
And
have
so
to
we don't know if it's functional
I guess I don't.
because you're taking hormones, right?
Right.
Okay. Okay, and?
So I wanted to know, do I have to take this
Okay.
medication?
Okay.
for the
Well,
rest
I would have them do a blood test and see what's going on, with the hormones in your thyroid, the hormones for your pituitary, TSH and thyroxine and stuff. And they could give you a clue whether your thyroid is dead or alive, so to speak. But in the meantime, what you want to do is get rid of all the bad stuff out of your life, the fried foods, the processed meats, the oils, the gluten. And you also want to get rid of cruciferous vegetables. Anytime you have anything wrong with your thyroid, you want to get rid of cruciferous vegetables. That means no broccoli, no cabbage, cauliflower, Brussels sprouts, or kale, because they interfere with thyroid. And then you want to take, in addition to 2 healthy brain and heart packs, one full dose of breakfast, 1 full dose of dinner time. That'll last you a month, 2 full doses of the healthy brain and heart pack per month. You also want to throw in what we call the Ocean's Gold. Go ahead and take 3 of those at breakfast, 3 at dinner time, it's 2 bottles a month. And that was how long ago they did that with the iodine?
About 20 years.
22
About
years?
20 years ago.
Okay, 22 years ago, okay. And so the problem hasn't come back or anything?
They just check my levels, tell me if I need more or less.
Okay,
Yes.
sure. Okay, well, let's just do that. Okay?
Thank you.
You bet. Okay,
Hi,
question?
good afternoon. I was diagnosed with alopecia, and I was told that because of my thyroid condition, I take the Synthroid, that it would be irreversible. So I wanted to know if there's some
Okay.
possibility
So
that
you
that
have
can...
alopecia universalis, kind of loss of hair loss everywhere? kind of
Not
thing?
everywhere.
Primarily here?
Yeah.
Okay. Well, interesting, the Japanese have done lots of research on male pattern baldness. I am very
Yeah.
interested in that, obviously,
Yeah.
in the research. And they say that male pattern baldness, primarily the head, is due to a tin deficiency. So the nice thing about our minerals is it has a lot of tin. And I'd say 12, 15 years ago, I was like Yul Brynner. There was nothing up there. So I've grown a lot of hair since I've been really upping my mineral intake, probably because of the tin. But I've also been gluten-free so I can absorb stuff. Okay. And so are these your real eyebrows?
Yes.
Okay, that's good.
Yes.
Very good. And so I would go with 2 of the healthy brain and heart packs per month, a full dose of everything twice a day, 2 healthy brain and heart packs per month. And then we have what we call hair, skin, and nails. Go ahead and get 2 bottles of that a month, take 3 at breakfast, 3 at dinner time, and get rid of all the bad stuff. All righty?
So that biotin, is that something that's... Biotin, have you heard of that? Biotin? Many people have suggested that for hair, nails.
You're talking about eating buffalo meat, bison?
No. Biotin. No? Okay. All right,
Yeah.
thank you.
Okay.
Thank you.
Okay. Yes.
Thank you for being here.
Very sweet. Thank you.
I've been diagnosed with PMR, polymyelitis rheumatica.
Okay.
And I had a triple bypass 8 years ago. I still have ongoing cardiac issues, so I'm on Brilinta and several other medications.
Sure.
So my question is, the PMR is kicking my butt, and I want to know how to ease some of the pain and the discomfort from that disease.
Okay, BMR?
Polymyelitis rheumatica.
Okay. Yeah, another name for it is fibromyalgia.
They told me that it was different from fibromyalgia because they said it was worse than, I don't want to be worse, but I had 2 doctors tell me that there was a
the
difference.
rheumatica piece is more in the joints than the soft tissue, but it's a similar disease.
It's both.
Yeah, and both of them are related to lupus and kind of things, kind of a cousin to lupus also.
Oh.
And so what you want to do is get off of gluten, no wheat, no barley, rye, no oats. I'd go ahead and take 2 of the healthy brain and heart packs per month, a full dose of everything at breakfast and full dose of everything at dinner time. Get yourself 2 bottles of the large glucogel, so you can take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And for the discomfort, what you need to do is take what we call the CM Plus capsules. Take 3 of those twice a day. And it's going to be a universal anti-inflammatory, analgesic, pain-relieving thing. And don't cold turkey off of any medication, particularly the pain stuff. And so what you want to do is, like, how often do you see the doctor?
Every couple of months.
Every couple of months, okay.
Yeah.
So you start this now, and again, no fried foods, processed meats, oils, or gluten. And then when you go see him, say, you know, I'm feeling pretty good. I've been changing my diet and taking some supplements. And can you possibly reduce the
medication.
prescription of or 1 or so of these medications? Let the guy who wrote the prescription do that. Okay?
Okay, thank you.
You're very welcome. Okay, over here, yes.
Yes, hi, good afternoon. I have a child that was diagnosed with ADHD at the age of 5, and he's been on medication since then.
Ritalin?
No, Adderall XR.
Adderall, okay.
Yeah. So, do you have any recommendation?
Sure. And again, this is kind of the second time we've touched on this. And so I want everybody to listen up that has a child or a grandchild or a cousin or somebody with ADD, ADHD, regardless of age. This is a 4-year-old.
He was diagnosed at 5. He's an adult now.
Oh, he's an adult now?
Yes.
But as an adult, how old?
19.
19, okay. Young adult. So, does he have any history of skin problems, eczema, dermatitis, psoriasis?
Yeah.
Well, there's the bingo.
Younger, he had...
Yeah, there's the bingo again. And so he can't absorb nutrients is a problem because his intestines are damaged. Remember seeing the rat intestines?
He doesn't have skin problems now, though.
It doesn't matter.
Okay.
Doesn't matter. He still has the clinical symptoms of the deficiency, which is caused by... Okay. So, do you have any other children?
Yes.
Do any of them have any asthma or skin problems?
Skin problems.
Skin problems, okay. Yeah, they all have a gluten intolerance. Do you have any brothers and sisters?
Yes.
Do any of them have skin problems or asthma?
No.
Anybody have any bowel problems or appendix out, anything like that?
No.
Okay, well, if you have a gluten intolerance, if you're all blood brothers and sisters, then they got it too. You need to talk about their kids, see if any of their kids have any asthma or bronchitis.
I have a nephew with asthma.
Has a nephew with asthma? Yeah.
Yeah, I have a nephew
yeah,
with asthma.
It's through your whole family, so the whole family's got to be gluten-free. Then, 19 years old, is he a big fella or small or?
Thin and
Thin.
athletic.
Okay, athletic, and so maybe what, 180, 175?
180, 185.
Okay, 180, 185. So, he needs 2 healthy brain and heart packs per month. Full dose of everything twice a day. I would also get him the Synaptive, so he can take 3 of those twice a day, be 2 bottles a month. That's for the brain function. Also, De-Stress, which has for the metabolism of the brain. I can take 3 of those twice a day. De-Stress, capital D like David, dash stress. And then none of the bad stuff. No fried foods, no processed meats, no oils, no gluten, no sugar in this case. And eventually he'll be able to eat a little bit of sugar, like a sweet potato or some grapes or something like that. But right now, he's going to be totally sugar-free. No juices, no fruit, dried fruit, fresh fruit. Vegetables will give him everything he needs from fruit without all the risk of sugar, because sugar contributes to these kind of things, makes them worse. But this is a easily fixable thing, but the underlying problem is a gluten problem. Can't absorb the nutrients, and this is why he's having problems. Okay?
Thank you.
Okay. Yes.
Good afternoon. I
Hi.
don't know where to start. The pain goes all the way through my body. I have narrowing here, degenerating spurs all the way down my spine.
Okay, bone spurs up and down your
Bone
spine.
spurs. And is that contributing to my legs?
Okay, yep.
The arthritis, where there's times I can't walk.
Okay. And when you lay down, is it worse or better? Or the
It's
same?
kind of the same.
Kind of the same,
I
okay.
sleep on like an angle.
So you find a place that's the most comfortable.
Yeah, because they're
Okay.
trying to give me injections, and I don't want to do the injections.
Okay. Do you have any history of asthma, bronchitis?
No, just heart.
Okay. Anything going on with skin?
No.
Okay. Anything going on with bowels, like constipation, diarrhea, irritable bowel syndrome?
No.
Appendicitis?
None.
Kids have any of that? Brothers and sisters have any of that?
No.
I'm still going to put you on a gluten-free diet anyway. Okay, no gluten, no wheat, barley, rye, and oats, no fried foods and processed meats, no oils, no gluten. And then you want to take 2 of the healthy bone and joint packs per month. 2 healthy bone and joint packs per month. A full dose of everything twice a day except for the glucogel, 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And you can use the CM cream that come with those 2 healthy bone and joint packs. Apply that to your knees, okay? And if you get, the pain is 50% better but not totally gone, We have what we call trauma oil. It's a blend of aromatherapy oils. You can apply 4 or 5 drops of that in a teaspoon of the CM cream and apply that to your knees or hips or your backs. Have somebody put on your back for you. Those spurs will go away without surgery. They'll just go right back into the bone. Bone spurs always occur whether in your heel, your vertebrae, your neck, your elbows. Bone spurs always occur where a tendon or ligament hooks into the bone, and as you move your muscles and bend over and twirl around, those tendons and ligaments pull on the bone, and the spur kind of comes up, or a calcium deposit comes up. You take the right nutrients, it'll support and promote maintenance repair, they go right back into the bone.
Okay.
Okay, do not get surgery for that stuff.
No, they were trying to do all that. I want.
Yeah, no, don't get the surgery. Don't let them put rods or wires or plates or anything. Stay away from all that.
How about the injections?
Well, have they worked for you?
No.
Okay, have you ever heard that insanity is doing the same thing over and over and expecting a different result?
That'll
Albert
be
Einstein said that, and I'll take his word for it, right?
Okay.
Yeah, and so just remember, your doctor has to make a living.
Well, we go at it all the time.
Good. Well, if you go at it all the time, you know, I'd stay away from that doctor.
Yeah.
You can fire him online. The phone book is full of hungry doctors.
Yeah. So I ended up leaving without taking the shot. So the whole staff is like looking at me like, really? And I'm like, yes, really.
Yeah.
No.
Yeah,
No.
well, see, when they get somebody on a trail, and again, this is what Dr. King was going after, just like a mammogram. Okay, well, it's all highly suspicious here. We're going to err on the side of conservatism here. We're going to do a biopsy. Well, the biopsy is unequivocal. We can't quite tell for sure. We're still going to get you on chemotherapy and radiation and do a mastectomy because that's a prudent thing to do. Okay? And so they're going to run you through hundreds of thousands of dollars worth of treatment.
Yeah,
You
but
really didn't need it because they need the income to get their kid through college.
Well, I asked the questions that people don't want to ask.
Okay.
So it's great.
Yeah.
Thank you.
So, yeah.
Thank you.
You're very welcome.
God bless you, Doctor.
Well, I know God loves me. I
yes.
love that part.
I'm standing instead for my sister. She's been on dialysis for 4 years.
And does she have diabetes also?
No.
Okay, so she got kidney failure.
Yes.
Okay. When you have kidney failure, there's nothing wrong with your kidney. I'm going to say that again because it strikes people as very interesting. When you have kidney failure, there's nothing wrong with your kidneys. I'll give you an example. Let's say you're taking a shower and the water's coming up around your ankles, around your knees, and it flows over into the floor in the bathroom. So you have your cell phone, you call a home appliance place, you say, look, I need you to come out here and replace my bathtub. Is that the right thing to do? No. What you want to do is call the plumber and say, hey, I need the willow tree roots rotor-rooted out of the drain because the tub won't drain. So when you have a kidney failure, there's nothing wrong with your kidney. Putting you on dialysis may be life-saving for a couple of weeks, but after that you shouldn't need it. And so they'll put you on there for a couple of years until they really need some serious money, then they'll find a kidney for you to get a kidney transplant. But I've had people that haven't urinated in 10 years. They're on dialysis 6 times a week. And after a couple of months, they're urinating again. After another couple of months, they're off of dialysis. It's easy to get people off of dialysis. What you have to do, remember, the kidney's okay. The reason why the kidney's not working is not because there's anything wrong with the kidneys, because the blood vessels that are carrying the dirty blood into the filtering unit are plugged. So our goal here is to get blood flowing into the filtering units. So what you do, you're sort of a medium-sized woman, right? What do you weigh?
She is.
Oh, she is. What does she weigh?
Yeah.
What does she weigh, you think? 150, 180?
150.
150, okay. So I'd give her 2 healthy brain and heart packs per month, okay, for just the general stuff, everything, her kidneys and liver and heart and brain need all that stuff. But also, I'd get her the Ultimate Daily Classic tablets, have her take 3 of those 3 times a day, 3 at breakfast, 3 at lunch, 3 at dinner. And then I'd have her take 2 a day of the Ultimate Cardio Sticks, 1 at breakfast, 1 at dinner time. I'd also have her take 2 a day of the Ultimate Niacin Plus. They are non-flush, they are time release. Have her take 1 at breakfast, 1 at dinner time. There's 1 bottle a month. And the whole idea here is to dilate those arteries going into the kidney, the ones that are already in the kidney, the arteries. The little afferent arteries are like 10,000 times smaller than the diameter of your hair. And they carry the red blood cells 1 at a time into the filtering units. Sometimes those arteries are so small, the red blood cell has to fold over like a taco to get through there, right? And this program will support and promote healthy blood flow through those blocked arteries into the kidney, and the kidney will wake up out of its hibernation, start working again. And sometimes, I'm sure they're taking a blood test every month and just putting it in the book like they're supposed to. Well, suddenly now they're going to see that there's improvement on the filtration rate, and they're going to say, we need to redo your test here. That doesn't seem right, and it'll be right. And so it might take a couple of weeks, it might take a couple of months, but it'll happen, okay? But it'll happen the quickest when she stays away from the fried foods, the processed meats, the oils, and gluten, because that's what plugs the arteries. Okay?
Thank you.
You're welcome. Okay.
Hello?
Hi.
I was asked really about kidneys, disease, and kidney failure.
Okay, so you have kidney failure.
Yes.
And do you have diabetes?
No.
Okay, I missed the first one then?
Kidney disease.
Okay, kidney disease. Okay, kidney failure. And you're a big fella. What do you weigh?
220.
220. Okay, so how long have you been on dialysis?
3 years.
3 years, okay. I would do the same thing as this lady's friend. You need 2 healthy brain and heart packs per month. I'd go ahead and get the Ultimate Daily Classic. Go ahead and take 9 of those a day. That'll be 2 bottles a month. 3 at breakfast because you're a big fella. I'd have you take 3 at breakfast, 3 at lunch, 3 at dinner. I'd also have you take 2 of the Ultimate Cardio Sticks a day, maybe 3. Take 1 at breakfast, 1 at lunch, 1 at dinner. So it'll be 3. It'll be 3 boxes a month. They come in boxes of 30. If it's a financial thing, don't go any lower than 2 a day. I would also do the Ultimate Niacin Plus. But I'd go ahead and get 2 bottles of those Ultimate Niacin Plus. So you can take 2 at breakfast and 2 at dinner time. And that's, again, going to dilate these arteries, get the blood flowing through. That's the whole idea of kidney failure. Now, you've got to stop the ongoing damage. Now, the interesting thing about when you have plugged arteries going into the kidneys and you require kidney dialysis to keep all the blood values correct, that's not the only place in your body you got blocked arteries. You're going to get them in your brain and get vascular dementia. You're going to get them in your eyes and get glaucoma. You're going to get them in your heart and get coronary artery disease, because the arteries in your body don't get obstructed in just one little place, because all the fried foods and processed meats and oils and gluten affect every artery in the body. So you're getting a warning that there's something bad happening in other places, right? And especially being a male, being a man, we tend to have worse results than women when it comes to these things. And so that's, you need to appreciate that. You need to be really serious about keeping away from the fried foods and processed meats, the oils, and gluten. That includes dog food in the house has to be dry dog food. It's got to be gluten-free. It's got to be rice and lamb. The first 4 ingredients cannot be wheat, barley, rye, and oats. Cat food, bird food, fish food, spouse, mother-in-law, kids, everybody in the household. If you have any brothers and sisters, if your mom's still alive, auntie's still alive on your mom's side, everybody's got to be warned. If you have sisters, blood sisters, their children will have the same problem. Okay, so it's important.
Thank you.
Okay, you're very welcome, sir.
Good afternoon.
Hi.
I'm a 48-year-old mother of 6, and I'm having trouble just keeping my body temperature to stay warm. I'm usually cold all the time. When everybody else is hot, I'm usually cold. I had blood work done. Only thing my doctor said I need was vitamin D.
Your doctor said?
I just need vitamin D, to take vitamin D.
I'm missing that body. Your doctor says you need?
I'm usually always cold all the time.
Yeah, I understand.
The doctor just told me I need to take vitamin D. They did blood work.
Vitamin D?
Yeah, just to take vitamin
okay.
D.
I got you, okay. How much do you weigh?
About 150.
Okay. And you have children?
I have 6.
You have 6, okay.
Yes.
Any of them have any health problems, asthma, bronchitis?
Yeah, we all have asthma.
Oh. Okay, what's the problem, ladies and gentlemen? Gluten. You got it. You got a gluten intolerance.
Okay.
Your brothers and sisters, your mom if she's still alive, all your babies need to be gluten-free, man living in the house, spouse, or... Okay.
He the babysitter.
Babysitter, okay. But man, spouse, mother-in-law, kids, what do you work outside the home?
Yes.
And what kind of work do you do?
I work as an ambassador, and I do security.
Oh, your mom's an ambassador?
I said me. You said what kind of work do I do?
Oh, okay. Okay. Do you know karate and all that stuff?
No, sir, I do not.
Okay.
But if I had to take somebody down, I could. Yeah.
Okay. Okay. That's an equalizer, isn't it? Okay. 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 So, at any rate, yeah, at 150 pounds, I'd go ahead and have you take, again, 2 healthy brain and heart packs per month. Okay? And I want you to take the Ultimate Dailies Classic, Ultimate Daily Classic. Take 3 of those twice a day. And I also have you take, just try something as simple as the Ultimate Niacin Plus. Take 1 of those at breakfast and dinner. There'll be 1 bottle a month. Keep the cost down for you.
Okay.
And the idea is to dilate the blood vessels in your hands and your feet. Have you shrunk any in height since you were a child?
I may have.
Okay, possible, okay. So yeah, you want to measure yourself now and go back and think, how tall was I when I was 18? And how tall am I now? Have I shrunk an inch or a half inch or something? Because that can impact, because you can actually smash some of these nerves, which will, in your back, which will clamp down on the blood vessels going into your feet and hands and have cold hands and feet because of a back problem. That's also a possibility. And so, but it's going to be imperative to get the whole household gluten-free, okay? And be aware of that when you're around people, when you're doing your security job and stuff. Be real careful about shaking hands with people you just saw. Oops. Oh, she needs to be a pitcher. That was pretty good. Okay. Okay?
All right, thanks.
Okay, thank you for your service. Okay.
Good
I think
afternoon.
we've got about 5 more minutes. Is that right, Pastor? Would that make it an hour? Is that correct? How much more time we have? I'm sorry? How much more time do we have to make it an hour? 5 minutes, okay. So we're going to take one here, one there. And I apologize, we'll have to end it there, but you can still have a relationship with longevity. We're going to be around for generations and generations and generations. And these folks out at the table will be able to help you. I don't know how long they're going to stay out there and do that. But you can write things down, and you can call us. They'll give you toll-free numbers and internet and so forth. And so you'll find that we're going to help you. It might take a couple extra days, but we will help you. Okay, yes.
Good afternoon. My husband just recently had heart surgery to replace a heart valve about 3 weeks ago, and he also got a pacemaker. So when he came home, he's on about 7 or 8 different medicines. So I was wondering, is there anything that we could do to maybe reduce the amount of medicine he'll be taking ongoing?
Okay, well, let me ask you a couple of questions. Before he had the valve replacement and the pacemaker installed, did he have any diagnosed heart disease other than the valve thing? Did he have congestive heart failure?
That's why we went to the hospital, because he was having trouble breathing.
Okay, fluid in his lungs?
Yes, and so they did tests, and they came back and said it was congestive heart failure.
Yeah. Okay, well, remember, congestive heart failure is caused by deficiency of a single vitamin. And I would have opted for a couple of weeks on the, maybe diuretics, get the fluid out of his lung and get him on the supplement program. Well, now they put a valve in, which now we got to deal with that. And so, now what does he weigh? Is he a big fella or medium size?
When he went in, he was about 230. Now he's down to about 218.
Okay, so 12 pounds of that was fluid. All right, and so what I would do is give him 2 of the healthy brain and heart packs per month, full dose everything twice a day, healthy brain and heart packs per month, 2 per month. I would also give him the de-stress capsules. I'd have him take 9 of those a day for a couple of months and then drop it down to 3 twice a day. But 3 times a day, that'll be 3 bottles a month, because that has that vitamin that's necessary for the congestive heart failure. And so I want him to take those. And also I want him to have the ultimate cardio sticks, 1 twice a day. That's 2 boxes a month. I want him to take the ultimate daily classic. You can take 3 of those twice a day. That's 2 bottles a month. And let's see here. I want to make sure that he's off all the bad stuff. In his case, fried foods, processed meats, oils, and gluten. But he also has to stay away from sugar. Sugar is one of the evil things when people have congestive heart failure and you're deficient in that vitamin. It can also result in dementia and other problems. So we want to make sure that he's taking those 3 of the de-stress capsules 3 times a day. And no fried foods, no processed meats, no oils, no gluten, no sugar.
No sugar from fruits either?
No fruit.
Okay.
No fruit juices. He can have all the vegetables he wants. You can melt butter and put them on the steamed vegetables. Don't cook them in oil or anything like that, because that's going to contribute to the problem, okay?
Okay, thank you.
Our goal here is to tone his heart up, so the heart kind of tones up to its optimal size. Usually when you have congestive heart failure, it's bigger than normal, and those valve leaves don't meet.
Right.
And so when you tone up the heart and it gets smaller and it's the right size, suddenly all those valves meet.
Oh, okay.
Okay, so that's why I say I would have wanted to been given a month before surgery would have been an option.
Okay.
And so anyway, we're at now, and so we'll do great with him, okay?
Okay, thank you.
Okay, God bless. Okay, last one. Yes, ma'am?
Hi, good afternoon, doctor. As a medical professional myself, I just wanted to know,
I'm sorry, I apologize. Are you a nurse or a doctor?
No, I'm actually a medical assistant. I'm
Okay.
furthering my education
Okay.
with hopes to become a doctor.
Okay, let's give her a hand.
And after hearing what you said and stuff, I was wondering if you had like any mentorship programs, any educational programs, and where do I go from here?
Okay, what you want to do is talk to those folks at the table and let them know you're interested in going further, because we're looking for everybody to join us in this mission, because it's a God mission. And we do have, actually, I'd say a couple of dozen pharmacists who work with us. We have a couple of dozen PAs, physician's assistants. We have maybe 100 chiropractors, 100 naturopathic physicians. We have quite a few Chinese traditional medical and doctors. Lots of nurses, every kind of nurse you can think of, probably hundreds of nurses. So we're very, very proud of the medical professionals who do associate with us. And as a medical technician, you're going to see things in the clinic and the hospital and stuff. Yes. And, you know, in all professions, there's always room for improvement, right? Only God is perfect. And so it pays for us to be kind of a watchdog on behalf of the public and, you know, keep the doctor's feet to the fire, so to speak, so they're doing all the right stuff. And a doctor, are you sure you want to give that dose to that 3-year-old kid? That's the 300-pound man's dose. Oh, thank you. Yeah, I got the wrong decimal point. And so we want to be watchful for people, because we can save lives by doing that. But also, our goal is to educate as many medical professionals as possible. But I will tell you that I have probably about 250,000 what I call PAs that I pay every month. Yeah. 250,000. These are not physician's assistants. They're my personal assistants, so I call them my PAs. And I have people who are 9th grade dropouts that know what to do for congestive heart failure and get rid of it, get them off the heart transplant list they've been on for 3 years and 2 weeks. Okay? These are high school dropouts, 9th grade dropouts. I have people with high school educations who are in charge of 500,000 people, who take care of 500,000 people each month, all with the internet and so forth. And they feed me information, but they're using these pre-programmed packages that we have for these 900 different diseases. And so you don't have to go to school for 8 years to become a brain surgeon or something like that to do these things, although we appreciate brain surgeons who do come with us. And so I was saying those things for the rest of you out here. If you're interested in becoming a student of this information, this will give you an enormous amount of, what should I say, points with your community, because you're going to be doing God stuff. Okay? And the beautiful thing about this is these individuals do not pay you anything. I pay you. See, we're a very large publicly traded company. I'll just tell you that much. You can look us up and you can look up our income and everything. We're a very large publicly traded company. I've been doing this for 38 years. And I personally have never taken a single penny from the corporation. I don't have to take a penny. I make my living selling books. Okay? Thank you. And I did that for several reasons, because I didn't want people to think, I believe that I'm doing God's work, because how does a 9-year-old kid figure this out? So I figured God gave it to me when I was 9. Okay? Been doing this since I was 9 years old. And so I purposely chose not to take any income from the sale of these products and from the services, purposely for 2 reasons. Number one, because I didn't want somebody to say, well, I may need this stuff, but I'm not going to take it because I don't want Wallach making any money. So I didn't want that to be in play. I also didn't want it to be in play that a medical doctor would say, well, just how much money are you making with that quackery stuff, Wallach? Okay, how much money are you making? I said, well, I don't take any money. I don't take a fee from these people. I don't make a penny from the sale of any of these products. I make not one single penny from the sale of any of the products. I take no office call fees, nothing. I give free service, been giving free service for 38 years. Doctor, how many free patient services do you do? Right? And so, and you don't get paid unless you're a licensed doctor and you want to do that out of your office. You'll get paid an office visit, right? But I urge you not to do that unless you're a licensed health professional, and you'll make more money than they do doing this, because America needs us badly. The world needs us badly. And you become a student of this information, people will know that you're a member of a healing church, right? And they will come to you and say, I hear you can help people with diabetes. You can help people with high blood pressure. You can help people who are on the heart transplant list, who are on the kidney dialysis laboratories 3 times a week. And you'll be able to help them. And the word gets out and out and out. And the thing that that has made America weak is we had more jobs than we had businesses. Now you think, well, wait a minute, jobs were good. Well, jobs are good, but what I said was we had more jobs than businesses. Okay, that's a bad thing. Well, the nice thing about this is you can keep your job. I don't want you to quit your job. You keep your job, do your best thing you can do for that job, keep getting raises and be a good part of the company. But also, how many tax breaks can you get when you're an employee? None. When you own your own little longevity business, you got the same tax breaks as Bill Gates, Warren Buffett, Donald Trump, and all the billionaires. Okay? Let's say you're having trouble with your insurance with the company you're working in. They take you from a full-time employee to a part-time so they don't have to pay insurance anymore. Or maybe your insurance company says, well, your deductible used to be $300 and now it'll be $3,000. Suddenly now that insurance is not so attractive. So what you can do, shop around, and then you write yourself a little business plan. And in this business plan, you say, my little longevity business is going to pay for my monthly health insurance premiums, my monthly life insurance premiums, and my fitness center memberships. Well, I'm not making that much money yet. It might take a year or two to make that much money. No problem. Out of your pocket, you write a check into your business checking account, and you loan it with a piece of paper that says you're making a loan each month to pay that through your company system. And then when your company's making that much, it'll pay you the money back. But in the meantime, you get tax deductions that you're going to get back almost all of your withholdings, which amounts to several $1,000s a year. You get that back, which is money the government would do silly things with. Okay? You have more money to tithe to the church. Okay? So these are the things you can do when you own your own business. It's amazing. All the tax laws, all the benefits, the real hard benefits that we get as Americans are for people who own their own business. Okay. You got it?
Yes, thank you.
Okay, last one. Okay.
Good afternoon. Approximately 10 years ago, my husband was diagnosed with sarcoidosis.
Okay.
And most recently, he had a sinus surgery, and unbeknownst to the doctor, the sarcoid was in his nose.
Now I missed the first part of that because I couldn't hear it from down there.
Oh, my husband was diagnosed with sarcoidosis.
Okay.
So most recently, he had a sinus surgery, and the doctor did not know at the time that the sarcoidosis was in his nose. So now he is having a lot of trouble. He gets about 3 hours of sleep per night.
And how much does he weigh?
He weighs 240 pounds.
240? Okay. Does he have any other issues other than sarcoidosis? Any high blood pressure, diabetes?
High blood pressure.
High blood pressure, okay. Any kidney issues, any kidney failure?
No.
Okay. Any constipation, diarrhea?
No.
Skin problems, eczema, dermatitis, psoriasis?
Eczema.
Eczema, okay. Well, what's the problem? Gluten. She got a gluten problem. Now, sarcoidosis is a close cousin to lupus and fibromyalgia, okay? It's caused by a gluten intolerance, not being able to absorb the minerals properly, right? Even if you're supplementing with them. So he's got to be, and you got to be, the dog, the cat, the bird, the fish, kids in the house, his brothers and sisters, his mama, all his aunties and uncles on his mama's side have got to be drop-dead gluten-free, okay? No wheat, no barley, no oats, no fried foods, no processed meats, no oils. And I would give him 2 healthy brain and heart packs per month, a full dose, I think, twice a day. I would also give him the Immortalium. It's the first time I've said it tonight, Immortalium, which it stimulates stem cells. Stem cells regrow stuff, like joints and cartilage and ligaments and tendons, lung tissue. It'll support the regrowth of stem cells for healthy intestines and so forth, skin. And so I'd have him take 3 of those Immortalium twice a day. It's 2 bottles a month. And again, no fried foods, processed meats, oils, or gluten. And it's amazing how quickly they show benefit. Usually 4 to 6 weeks, you're going to see something recognizable. He'll notice things within 4 to 6 weeks where it's recognizable. If he has pain, inflammation inside, or pain in any joints or muscles or anything, he can use the CM Plus capsules orally. Take 3 of those twice a day. It'll be 2 bottles a month. He can use the CM cream topically wherever he has pain in a joint or muscle or tendon. And he'll get relief for about 3 to 5 hours. He might have to do it twice a day. Okay?
Thank you.
You're welcome. Okay, now just kind of a final thing here. Again, when you order these products, You're going to pay wholesale. We don't charge retail for any of these things when you join us. You're going to pay wholesale. You're going to pay the same thing I pay when I buy my products. The company doesn't even give me products. They set up, I have to buy my own products. So everybody who buys from our company, you're going to buy only wholesale. You can get free shipping if you get on what's called auto ship, because the computer generates everything and out it goes. It saves us a lot of time, money, and energy, so we pass that savings on to you. We'll pay the shipping. If you get on auto ship, you can always change it. If you want to reduce this, add this, you can always do that without any penalty or fees. And so you want to consider that. Also, every time you get 3 people started, let's say you get 3 people started just on the basic program, the Healthy Start Pack, just the 90. You have 3 people in a month do that, I'll give you a Healthy Start Pack for free. If you just get 3 new people started, you'll get one for free. If you do that every month for 100 years, you get one every month free for 100 years. Okay, it's not just a one-time deal. And this is for everybody. You don't have to be a distributor. You don't have to even pay the $25 one time. It's free, even as a preferred customer, we call it. And so you can go as fast or as slow. You can be a customer for 100 years. We love you. We don't force anybody to become distributors. It's there if you want it. You don't have to be involved in it if you don't want to be, okay? I want to thank you for being such a kind family, for welcoming me in. We love you. God bless you. Look forward to working with you. Thank you very much. Thank you.